Good evening. First off, I'd like to thank you guys for being here today. I'm Reid, and I'm going to talk about a subject that kind of gets pushed under the rug, but I think it should be talked about because awareness could save some lives. I'd like to start by sharing a story about a woman named Stephanie Hammer Samuels. Stephanie was 39 years old and healthy. She wasn't a smoker and had no history of heart disease in her family. She was a woman of adventure, the thought of a heart attack never crossing her mind. Stephanie went on a hiking trip with her friends in Colorado in 2005, and after the trip she started having symptoms that were kind of frustrating her. She had some nausea that lasted over a week, which she tried to think was just pregnancy, but some home tests came up negative, so it couldn't be that. She was experiencing shortness of breath even just walking up a flight of stairs. The symptoms were frustrating to her because in the world of health, she did everything right. She went to yoga classes and she exercised regularly and she ate more fruits and vegetables than anything else. With these reactions, Stephanie had all the symptoms of heart disease, but she went undiagnosed for 4 weeks while her doctor ruled out things like acid reflux, thyroid problems, and potential pregnancy. Not one doctor mentioned a problem with Stephanie's heart, which left her worried. She called her good friend that happened to be a nurse to try to get some answers. Her friend got her in to take a stress test involving treadmill segments. On the second treadmill test, Stephanie's blood pressure dropped and she collapsed. It took a heart attack for Stephanie to get the medical attention that she needed. Heart attacks are the #1 cause of death of women in America. Contrary to common belief, heart disease kills 6 times as many women as breast cancer. In fact, according to the Healthy Heart Guide, recent studies show that 1 in 2 women will die of a heart attack or stroke. Statistics from the American Heart Association show that there were 831,000 deaths in 2006 as a result of heart attacks. 432,000 were from women. That is 17,000 more women than men. Why is this the case? More women than men are killed each year as a result of heart attacks because there is a lack of awareness among women in America. The signs of male heart attacks are almost common knowledge. We learn about them in health class and we see them in movies. However, women experience different warning signs of a heart attack, and knowing these signs could save your life. We all know that severe squeezing chest pains and shortness of breath are the typical signs of a heart attack, but these are the typical signs of a male heart attack. In fact, studies show that though some women experience chest pains, most do not. The typical symptoms of a female heart attack include shortness of breath, which we often mistake for being out of shape, weakness, unusual fatigue, which we blame on our busy lives catching up on us, body aches, particularly in the back and neck, and we often blame those on arthritis, burning in the stomach or chest, which we sometimes mistake for heartburn or indigestion. And also chest pains, though as I mentioned, most don't experience chest pains. As you can tell, many female symptoms are easy to push aside with labels such as stress, lack of sleep, or heartburn, which is why it is so important that you pay attention to what your body is trying to tell you, especially if you fall into the categories that are considered risk factors for female heart attacks. There are 2 separate kinds of risk factors that we should all be aware of, the ones that we can't control and the ones that we can control. The factors that are out of our control are age, because unfortunately we can't control this, but if you're over 55, you are more at risk. Heredity, because if it runs in the family, you should let your doctor know. If you experience premature menopause, or if you have suffered previous heart attacks. If you fit into one of those categories, this does not mean that you'll die from a heart attack. It means that you should be especially familiar with the warning signs of one. During an attack, should you ever experience one, time is of the essence, and getting medical help immediately can save your life. There are also risk factors that you can control, like smoking, high cholesterol, high blood pressure, lack of physical activity. If you're taking birth control over the age of 35, especially coupled with smoking. Being overstressed can put you at risk as well. If you suffer from this, there are many things you can do to de-stress yourself, like yoga, meditation, therapy, or journaling. Consuming too much sodium and not enough veggies will also put you at risk. So remember that heart attacks are preventable too. Have your cholesterol and blood pressure checked regularly and heart healthy checks annually, especially if you're over 50. Refresh yourself and friends, if you can, on the warning signs regularly. Confidence in the symptoms that you may experience will make you more assertive if a doctor questions you. Ask for the cardiologist. If symptoms are severe, call 911. Women often feel that they can do anything, but don't drive yourself to the ER. If you are in serious pain, hitch a ride from an ambulance and spare the lives of others on the road. Remember to always listen to your body, even if doctors tell you that you're wrong a few times. Your body tells you when there's something wrong, so always seek medical help if you are feeling any symptoms that could relate to heart disease. Like Stephanie Hammer Samuel said, women have really good instincts, but we cover them up because we tend to think that we can do more. In any case, it's better to be safe than sorry, and remember, early diagnosis means early treatment, which brings you just that much closer to saving your life. Again, thank you for being here today. I hope you have become more aware of the risk and prevalence of heart attacks in women. Share your knowledge and save some lives.